So today we're going to be continuing our series on pain talks. So our first question for Eileen here, because really we want her to be the center here, is what is it like living with chronic pain as someone that, you were diagnosed with rheumatoid arthritis at quite a young age. So what's that been like for you?
Well, I was diagnosed at 29 with rheumatoid arthritis, but it definitely took me a number of years to get a diagnosis. My symptoms probably started in my early 20s, and then I was working as a esthetician. So I just kind of thought it was carpal tunnel or bad posture, or I needed to exercise more. And whenever I brought this up to physicians, they kind of said the same thing, or they told me to wear a wrist brace. However, when I wore those wrist brace at night, they were incredibly uncomfortable, probably due to the swelling that I was experiencing in my hands, but it wasn't like huge swelling, so it wasn't anything that was alarming to me. It was mostly my hands felt really hot and painful. So it took me a while to get the diagnosis. It was actually after the birth of my son, and when I returned to work after maternity leave, I expected carpal tunnel to end. I expected the swelling and pain after pregnancy to end, but it didn't. And so that's when I kind of really knew that I needed to bring my pain up to my physician. And coworkers of mine were telling me to maybe check out rheumatoid arthritis. And at that time, I kind of knew that I did need to check that out because I had an aunt living with RA. She was diagnosed 40 years prior to me. And so I got in to see the rheumatologist. She said, definitely have RA. And that's when I kind of realized my pain was never actually going to go away. It was going to be chronic and there with me for life.
Right.
And it was quite debilitating. At that point, I was on disability, and I had to go through the medication phase, trying to learn to live with this illness and um, trying to find relief.
Right. I know. And it is unfortunate. I've heard from so many too that have, struggled as a parent with chronic pain, right? Then
Mhm.
trying to manage all these different, important things in our lives. And so how do you manage your chronic pain? I guess you've had quite the journey thinking of
Mhm.
even just the path to diagnosis, but beyond. But what are some of your ways that you try to manage your chronic pain?
Well, just like finding my diagnosis, the finding the way to self-manage my chronic pain took years. A lot of trial and error, errors landing me in bed for days or weeks, or with excruciating pain or fatigue. But over time, I've realized, and with researching and participating in, well, Arthritis Research Canada and other studies, or reading websites like the Arthritis Society, or blogging myself, or even just especially talking to other patients, I kind of picked up things. And mainly now I manage my disease with biologics, obviously. They help control my moderate to severe rheumatoid arthritis to an extent. But I also need to do other things during the day, like exercise. I would say exercise is my number one um, pain self-management technique, because movement really is lotion. So over the years, my exercise has changed from, low impact on the elliptical to hiking or yoga or swimming or strength training, um, Nordic walking poles. And I've learned over time how to do it safely and effectively with the guidance of kinesiologists or physiotherapists who have a background in arthritis care, which is very important because not everybody understands arthritis. And yeah, then the other thing is like diet. Diet's huge. So when I eat bad, I feel bad. When I eat good, I feel better. It's not always the case. Like, the disease can still be ugly even if we do everything right. Um, that's just kind of the nature of the beast. Then, pacing myself is really important, making sure I'm not overdoing it. Although I'm really bad at that one, I tend to overdo it a lot. And I would say focusing on good sleep is also a big one. Making sure I'm taking the moments that I need to rest, getting my 7, 8, 9 hours of sleep. And then controlling stress is another one. Stress is such a huge trigger for more pain. there's so many different techniques, and what works for one doesn't necessarily work for another. And sometimes they stop working or they don't work when you want them to.
Yeah, no, absolutely. It sounds like you've got a pretty, big toolbox of things that you use depending on what's going on. And there's just a lot of things that you can do. I mean,
Hmm.
I can relate to that myself with sleep is of utmost importance to me, which can be
Hmm.
elusive, as you can imagine, as a parent as well, in that
Yeah.
try.
And then like sleep and stress are huge, I think, because like when you live with chronic pain, it does land a lot of people on disability, and disability tends to pay below the poverty line. So it's hard to get a good night's sleep when you're super stressed out about your finances. And not to mention, taking care of chronic pain is very expensive itself. So it's definitely a challenge that kind of takes, I think, years to sort of navigate. And yeah, there are moments where it can feel overwhelming and like you can't get a break, but that's the nature of chronic pain.
Oh, it can be very tough, right? I know there's work that's being done to kind of recognize it as like a disease almost in and of itself. And I think that's important, right? To because sometimes
Absolutely. Yeah.
these things aren't as, taken as seriously as they should. You
Hmm.
talked a little, I guess, about some of the barriers or, some of the stress that you can have. But what have been some of the barriers? You mentioned like you have had access to a physiotherapist who knows about arthritis. So are there any
Hmm.
examples like that that have been particularly problematic for you? Or
Yeah, well, there's all sorts of barriers popping up at different times. Like wait lists can be a huge one. It took me 2 years to get to see a pain specialist, or it took over 9 months to get to see a physiotherapist who was trained in my condition. And those care providers aren't everywhere. So you also have to travel to get to see the ones that you need. And when you're dealing with fatigue and pain, the traveling alone is exhausting. And then there's also, of course, the financial barriers. A lot of things that help alleviate pain, like massage or healthy groceries with inflation, chiropractor, although I don't really go to the chiropractor anymore. But you want to try all these things when you're in pain, but a lot of them are so expensive and out of reach for people who are have really been impacted by pain, that can't work a normal job or have children to take care of, or they're just too exhausted to really take care of themselves. So maybe they have to order in food all the time, and that gets expensive. The delivery costs because you can't make it out. There's so many barriers, and it can be overwhelming having to tackle them all.
yeah, I've heard from many too, right? That living with chronic illness, including inflammatory arthritis, right, can be like a full-time job in its own right. I think you're
It absolutely is. It's dealing with the appointments and then the self management and then the symptoms itself. The symptoms don't take a break. They don't last 8 hours a day. They don't take 8 hours a day off for us to be able to work.
no, absolutely. Yeah, it's too bad we couldn't get paid for just managing ourselves at times. So no, it sounds like you've definitely found a lot of different strategies and ways to support yourself, which I think can then, support others and might be helpful to others. Would you
Mhm.
have any advice for people who are, struggling, living with chronic pain and can't quite seem to get it managed to a level that we can live with as so many of us do sort of live chronically with a certain level of pain in our lives. So do you have any
Mhm.
advice for them or
Yeah, when I'm really struggling and I feel like I'm just getting a bit overwhelmed, I kind of sit myself down and say, what's stressing me out? What are my barriers? What goals do I want to achieve right now? And what steps can I take to maybe alleviate some of this pain, the stress, or achieve my goals? It could be simply like I need to add in a walk every morning because getting up in the morning will help alleviate some of stiffness and fatigue, or creating an action plan that I maybe have fallen off of because I've been overwhelmed with other things, or just knowing when I need to talk to my doctor about it.
right? Yeah, yeah, and I do think you've been involved. I thought it might be you've done some work to offer some groups too to people in person in Vancouver. I don't know if you
Yeah.
want to. I wonder if that might be helpful to folks who live in your local area?
Yeah, so I run a support group for people living with arthritis at the Mary Pack Arthritis Clinic, called the Arthritis Social Hour. I received a grant from the Arthritis Society to be able to run this, and I used my connections through being a patient advocate and research to invite some clinicians and experts to come in and talk to us. But to be honest, I think the patients that do attend find the most benefit and joy out of talking to other patients. And patients tend to have a certain language that we speak to each other that, the physicians aren't talking the same, and our family who aren't going through the same things don't really understand. And you can learn a lot about your condition and experiences, from others, especially tips, like simple little tips, like how to use an elastic band to open up a can easier, something little like that. Um, and then just knowing that what they're going through is real and they're not alone. So there's, yeah, dealing with chronic pain, there isn't one solution. There's so many different avenues, and it's not going to work for everyone, each one.
I know for sure. And I think you're right. When we speak to each other, it is like a different language that, I always find it wonderful to be able to kind of relate to people who really, really know what it's like to kind of get through every day. So the value of social support, like what you're doing,
Mhm.
is very valuable to people, I think, and can really make
It
you
is.
feel like you belong to a community and who really understands you.
Mhm.
So I don't know if you have anything else to add, but I just like to, really thank you for doing this interview with us and sharing your words of wisdom with the arthritis community.
Well, thank you. Um, I don't know if I have anything else to add other than, just you have to take care of yourself and find joy.
Good, good words of advice. Thank you so much, Eileen.